All right, go ahead.
Okay, my name is Margaret Wylie, and 2 weeks ago today is February 12th, I came in here on a cane, heavily leaning on the cane, because my right hip hurt so bad it wasn't even funny. After I got started on the meds, I took a double dose before I went to bed. I made up a double dose to have next to my bed during the evening, during the night. The next day, 11 o'clock, I went to San Antonio. I drank some on the way down with the water with the meds in it. I walked 1.5 miles the day after I started these.
Really?
Then the next day, I also walked another 1.5 miles because I did all 3 layers of the Riverwalk Mall.
In San Antonio?
In San Antonio. And then I rode the bus back over to a place where I needed to be, and then I walked from there 3/4 of a mile back to stop and have dinner. Then I walked back to my hotel room and then walked back out, I guess it was about 1/2 mile, to have dinner again.
Uh-huh.
And I had lunch and then dinner, and I'm to the point to where now I hardly ever I keep the cane with me just in case, but I'm positive I won't have to use it ever again.
Wow. Now the cane was to help you with your hip pain.
Yes.
So you came in here.
Some of the pressure, but then when I were relieving the pressure with the cane, it put pressure on my shoulder and my arm.
Yeah.
And my back.
Right. Now, have you noticed any change in your sleep pattern?
Yes, I'm sleeping much longer.
Are
I
you?
mean, all my life I've slept like my mom. I could go to bed at midnight and be wide awake at 5:30.
Wow. Now?
And now I'm going to bed at 10, and this morning I had to set my alarm because yesterday morning I slept until 10 after 7.
Now, some people might think that you're not getting enough rest or that you feel more tired now. Would you say you feel more tired, or do you have more energy?
I have more energy.
You have more energy. So why would you explain maybe sleeping longer? Is it because you're getting a better rest?
I think so. I really do.
Do you feel more rested?
Yes, I do.
You feel more rested? Fantastic. Today we did our first session on your hip, where we went and did our physical myotherapy. How do you feel about your hip?
My hip feels fantastic. I mean, I don't have any pain right now. I can almost cross my right leg over my left knee and get it clear over like I can the left over the right. But it's a work in progress.
Certainly, certainly. Did we make a bunch of progress today?
Yes.
Fantastic. I think you're very strong today. It's going to be easy because of your dance background and that athletic mindset. I think you're going to be able to respond extremely fast.
Well, and I had a good example with my mother-in-law.
Yeah.
Do whatever it takes to get the job done.
Sure. Today's session was kind of like a workout, wasn't it?
Yes, it was.
But was it a good one?
Yes, it was very good.
It was pleasing. It was the deep tissue that works, but it was good, right?
Yes.
Fantastic. I really appreciate you. We're looking forward to a follow-up video. And how long has it been since you've been on the meds?
Just 2 weeks.
Only 2 weeks?
Only 2 weeks.
And so we've got another 2 weeks before that month's supply is completely wiped out. How are we doing? Are you about halfway through it?
About halfway through it.
Okay, fantastic. Thank you so much. We'll be in touch, okay?
All right.
I'll see you this next week, too, I think.
All right.